The COVID-19 pandemic has caused great turmoil all over the world, with important health, social, and economic damage. The consequences and casualties could have been even more terrible if not for the cooperation from citizens like you in responding to the pandemic. Citizens like you can work with scientists, participate in research, and even assist authorities in mitigating health crisis. Active public participation in scientific research to advance science and increase the citizens' capacities to understand and engage in science is referred to as citizen science. It is possible to become citizen scientists even without any particular scientific background, and depending on your level of engagement, there are different research activities you can take part in. At the first level, you will be consulted by professional scientists through research questions, neighborhood meetings, or public hearings. At the next level, beyond providing information, you will participate in design and execution of research studies. Even though you will have greater engagement, you are still a few steps away from being fully engaged. As you move further up the ladder of participation, you will work more closely with the researchers and become contributors of knowledge, expertise, and experience. You might also get opportunities to make crucial research decisions together. At the final level, you will be fully empowered to define research problems and implement solutions according to your community's needs. From here on, you are recognized as citizen expert, and decision-making powers rest in your hands. As a citizen scientist, you can participate in various research activities, including working with professional scientists and authorities to prepare and respond better against new and emerging infectious disease outbreaks. To know how you can be actively involved, you first need to understand the various stages of a pandemic. When a pandemic is declared, mobilizing the public to swiftly and effectively respond to the various stages can help save lives. Let's look at the various stages of a pandemic. The first stage is the pre-pandemic phase. During this stage, national planning strategies help to build trust and grow collective habits in the community. Proper execution of such strategies in your community facilitates instant mobilization in the event of an outbreak, thus reducing the risks of the local episode becoming global. The second stage is the alert phase. Community members like you are deployed at the center of a global and robust surveillance system to identify and monitor diverse data sources across the human-animal environment interface, what is known as the One Health approach. Consider a case of newly emerging infectious disease, which is transmitted from animals to humans. Continuous monitoring by farmers, hunters, market sellers, wild meat consumers, and other stakeholders will help identify and control the risks of new virus strains before a major outbreak occurs. As we move into the pandemic phase, your input on tailored visualizations is crucial for the effective communication about the disease to the general public. In this stage, you will also contribute to the process of coming up with various mathematical models of outbreak outcomes. The data you provide, along with your well-informed assumptions grounded in reality, is fed into a model to generate detailed insights to make crucial decisions. You are now in the final stage of the pandemic, the transition phase. In this phase, your insights on long-term health effects from the infection and potential side effects caused by the deployed cure will help researchers develop solutions to manage them and mitigate the socioeconomic impact of the pandemic. We at I-DAIR are working on participatory approaches for citizen science where the citizens are involved not only as data providers, but be empowered enough to engage in modeling, data interpretation, and visualization, as well as co-design the research project. We recognize community members as knowledge experts, and by creating an equal partnership between communities and scientific institutions, we can collectively prepare and respond better to the next pandemic.